For Florida medical practices, denied claims are an accelerating financial crisis, choking cash flow as uncollected revenue piles up faster than staff can process it. Nationally, there's a 25% spike in net revenue leakage from 2024 to 2025. Providers collectively lost $48.4 billion, with denial rates hitting 11.6%. Almost all of this recent increase comes from clinical denials, claims rejected over strict prior authorization and medical necessity. Relying on legacy, manual billing operations to fight this volume is a losing battle. The sheer math of current denial rates outpaces what a traditional back office can handle. The situation in Florida is significantly worse than the national average. 60% of the state's Medicare beneficiaries are enrolled in a Medicare Advantage plan, a number that hits a staggering 80% down in Miami-Dade County. This data visualization compares those Medicare Advantage plans against traditional Medicare, revealing that MA plans deny initial and final claims at more than double the rate of the traditional system. Layer on top of that Florida's Medicaid system, which fragments into multiple managed care organizations. Each MCO enforces its own strict, plan-specific timely filing windows that automatically trigger denials if missed. Applying a generalized national billing strategy to this hyper-specific payer matrix ensures a practice will absorb massive amounts of avoidable, unrecoverable losses. Navigating those specific payer rules requires highly trained personnel, but medical groups are bleeding business support staff at an annual turnover rate of 33.3%. This financial breakdown reveals the true weight of that attrition. On top of the base salary, replacing a single staff member burns through $9,000 to $30,000 in recruitment costs and lost productivity. Time is compounding the problem. The Florida legislature passed the Live Healthy Act, shortening the medical debt collection window to just 3 years. Every day an account ages while waiting for a new hire to get up to speed permanently shrinks your legal recovery runway. In-house billing turnover directly turns aging accounts into write-offs, creating a fatal disruption to your cash flow. High-performing practices are stepping out of this staffing spiral. They replace generalist employees with dedicated, credentialed outsource teams, working securely inside existing EMR platforms. These specialists run AI-augmented workflows that automatically flag missing prior authorizations and scrub coding errors before a claim ever leaves the building. This timeline maps the exact implementation process. A fully trained, seamlessly integrated revenue team can be deployed and tracking performance metrics in exactly 14 days. Moving the fight upstream immediately stops the cycle of reacting to denials and establishes a tightly controlled, proactive revenue system. This side-by-side comparison contrasts the volatile $75,000 burden of an in-house employee against the predictable $399 weekly cost of a dedicated specialist. This dedicated model maintains an error rate below 1% across 800 active practices. Upgrading to an outsourced, dedicated team is the mathematically sound strategy to protect your revenue. Visit staffingly.com/demo.